Welcome back to the Division of Mental Health and Addiction, Cultural Linguistic Competency 3.0, Organizational Excellence Toolkit. In this webinar, we are going to explore non-grant-based fundraising strategies. Before we begin on today's content, I want to share the goal of the Organizational Excellence Toolkit. The Division of Mental Health and Addiction's goal through this digital learning toolkit is to empower representative community-based organizations serving historically marginalized and underserved communities of Indiana with a seat at the table by providing information and resources that support collaboration opportunities that promotes quality, accessible behavioral health care, and sustainable community-centric services. Today on non-grant-based fundraising strategies, we are going to cover additional types of funders, how to make the ask to non-grant-based funders, and creating a scope of work to support fundraising initiatives and proposals. Let's get started. In our previous webinar, Diversified Funding Strategies, we learned about multiple different types of funders. A portion of this slide should look very familiar as we are, again, exploring the funders where, as the community-based organization, you are creating the ask. For these types of funding streams, we want to be creative with your ask and being specific in the cash to benefit for the funder. In the previous webinar, we discussed personal contributions and corporate sponsorships. In this webinar, in discussing non-grant-based fundraising strategies, we're going to explore the opportunity of expanding corporate sponsorships in event-based or multi-year contracts into ongoing mission-based continuous funding through local organizations in what is defined as institutional funding. So, for example, as a community-based organization today, you may already have multiple corporations, employers, other organizations that are continuously providing sponsorship level support for your events that are happening on an annual basis. Take a look at the inventory of those specific types of funders and begin aligning with their mission and vision and values to provide an unsolicited proposal to seek institutional level ongoing funding in support of continuation funding for your services direct to the community. A different way to say that is take a look at who you're working with today that have repetitively funded your events and provided sponsorships. Inventory who those organizations are. Are they banks, hospitals, local health departments, higher education organizations, employers, small businesses, and or large nonprofits? If they are, you're already one step closer to providing an ongoing institutional funding strategic plan. As you inventory those organizations that are currently providing sponsorships, think through and really look at how do those organizations' mission, vision, and values directly align with yours? And how is the funder's mission, vision, and values continuously funded? Meaning, where are banks receiving their funding from? And how did they take that funding in support and deployment to other organizations that are conducting community-based service work? Institutional funders commonly have very well stated, very publicized mission, vision, and values because as part of their funding goal, it is to grant make to local organizations that align with their mission, vision, and values to ensure that those dollars that are funded to them, or in other terms, the dollar profit to the organization, are being spent appropriately and accordingly with their mission, vision, values with community-based organizations that do direct service. In this webinar, we're going to review specifically 7 different types of institutional funders and how those categories of funders specifically fund today and how those funders provide ongoing funding and the way that they are seeking scopes of work in order to fund those opportunities. Institutional funders are a phenomenal way to continue sustainability for your community-based organization. Institutional funding does require a direct ask and does require consistency and well-organized documentation to showcase to that funder that your specific activities, strategies, and objectives align with their mission, vision, and values and are truly creating an impact within the community so that you can be a preferred funded organization by these institutional funders ongoing. Now, let's take a look at how do we make an ask to these institutional funders. When we look at these 7 different types of categories of funders, we can oversimplify making the ask into 4 steps. The first is starting with you. Your organization sends a proposal that includes a scope of work which is defined as an inventory of services, including a budget with a timeline to completion of those services, with a fee schedule of how and when you would like to be paid. That's the first step. Often organizations, when funder says, send me a proposal, are not necessarily clear on what should be in and identified within the proposal. Each proposal should be a scope of work that includes inventory of services, a budget, a timeline to completion, and a fee schedule. Typically, a proposal will also include a cover letter to identify how the opportunity came about and why a scope of work is being submitted. Then, once the scope of work is delivered, the institutional funder should then advise how their buying process works. For example, a bank providing funding through the Community Reinvestment Act is going to have a very different buying process than a higher education organization. A bank could simply provide a purchase order in support of services, or even a marketing sponsorship document that contains the components of your scope of work. A higher education provider generally will need to go through the contracting process in order to subcontract your organization to provide direct services. Do not be afraid to ask, how does your buying process work to institutional funders? Because only your point of contact from the institutional funder will be able to navigate you the appropriate steps, documentation needed, and the amount of time and effort that it will take for you to go through their buying process. Be vitally clear on the buying process of an institutional funder before you begin a scope of work. Oftentimes, these institutions will have a lengthy buying process because these are large dollar amounts that are available for support of funding to local organizations. With large dollars, typically cumbersome processes are created to ensure appropriate eligibility, validation of financial strength, and also consistency in delivery on the provided scope. If your institutional funder is not clear or does not provide you clarity on how their buying process works, pause the conversation and really address the step-by-step process before moving forward. You are a community-based organization that has to do many things, and trying to determine the procurement or buying process of an institutional funder is one of them, but should not be cumbersome. A good institutional funding partner will provide you clarity in how their buying process works and walk you through step by step in order for the ultimate goal, their available dollars provided to you and you utilizing those funding dollars to support direct service to the community. Step 2 is vital. We have to have clarity in the buying process. If the institutional funder is not aware, or if your point of contact at the institutional funder is not aware, ask for their support to seek clarity in their internal processes before moving forward. Once the buying process is clear to you, then your organization and institutional funder will then mutually agree upon and execute a contract that includes the details of your proposal. Again, Based upon the category of institutional funder, the contract process could be lengthy or it could be shortened through bid process and or small purchase orders. Again, please ensure that you understand the buying process in the institutional funder and also the terms of payment prior to executing a contract with institutional funder. Most of the institutional funders identified here have some option to provide advance payment funding in support of work to be done and personnel to be retained by your organization as a community-based organization. Ask if a institutional funder, one, provides advance payment to support personnel to begin design and implementation of a scope of work. Ask also, two, what the terms are for payment. Terms are negotiable. You can ask for advance payment due upon receipt of an invoice or terms that could be anywhere from 15 upwards of 60 days. This is your proposal, and in making the ask, so in your scope, in the timeline and fee schedule, identify the payment terms that will make sense for your organization. Most of these organizations will have boilerplate contracts that determine term length and payment advisory. Please look over those areas very closely and have a conversation with your institutional funder point of contact in discussing, is there an opportunity to, one, reduce the days of payment terms and or an opportunity for advance pay or retainer model when you are crafting your scope of work and ultimately reviewing that final contract. Once you've agreed to the contract, then the terms, payment schedule, and the schedule of fees and when you deliver those invoices have to be consistent with what the contract language is. Always ask, negotiate, and seek clarity prior to signing the contract. Banks, employers, small businesses, and large nonprofits, generally speaking, have a more negotiable length of term, meaning shorter payment timeframes and cycles and more opportunities to pay upfront as you request. So please request. Hospitals, local health departments, and higher education are typically bound by their funders' grants and also prior fraud, waste, and abuse laws that limit their ability to pay in advance, pay on retainer, or even pay shorter than a 30-day term. So as you look at your current sponsors and an inventory of what major organizations are providing sponsorship level support to you, really think through the category of institutional funders that you want to pursue in context of future funding, as not all institutional funders will provide fast cash or even supported development for personnel, given the type of payment terms and models that they have available today. Making the ask should be as simple as you sending a scope of work, the institutional funder determining the buying process, a mutually agreed upon contract with all of the clauses reviewed, negotiated, and discussed, and a tight invoicing schedule with direct follow-up for payment timeframes. We're now going to cover in-depth services, timeline, and budget and fee schedule. So what is the scope of work? A scope of work is an agreement that you as the community-based organization are initiating to your institutional funder that includes these four components. Why these four components? Well, services outline exactly what you are doing. Timeline outlines when you will be doing it, and a budget and fee schedule outlines how you will do it and when you will bill for what you have done. Now, recall during how to make an ask, we did discuss advance payment and retainer model. Advance payment and retainer model are very good upfront cash mechanisms that really showcase your institutional funder's level of trust to you as a community-based organization in providing extended cash access before services are delivered. It is truly a mark of a great partnership that institutional funders will provide advance payment prior to services delivered in support of a agreed upon scope of work. You want your scope of work to be very tight, very detailed, and very clear so that any organization reviewing the scope of work can immediately determine what is being funded, how it is being serviced, and under what timeline the services will be delivered in order to justify not only the advance payment, but continuation payments in your long-term partnership with the institutional funder. So kicking it off with services. Services is a specific section in your scope of work that answers these questions. Start with, who are you serving with these services? What is the demographic? What is the socioeconomics? What is the physical geographic, zip codes, county, or in some cases, plural, counties that you are serving? You are serving is a vitally important definitioning in services because it gives detail to exactly what type of culturally competent services, where those services are being provided, and ultimately what the ultimate benefit will be in support of the individuals being served. In looking at grants administration over the course of federal, state, and also local grants, the population that you are serving with very specific detail will be a differentiator in your scope of work. This is actually the most commonly missed inventory of definitions when it comes to services. Yes, you know very well who you are serving, but are you representing who you are serving to your funder in a way that allows the funder to understand the demographic, socioeconomic, geographic, and also culturally competent considerations of the population that you're serving? Secondly, what activities are being provided? I'm going to utilize the most simple definition of activities as the physical actions that are being supported as a direct benefit to the individual that is seeking services. That definition of activities supports your consideration of what personnel must conduct that action, what data must be collected to support proof of that action, a narrative of the intended and unintended outcomes, and quantitative data must be represented in order to report on the activities conducted. It is very difficult to bullet point activities being provided as a benefit statement to institutional funders, not just as a list of activities of actions being supported to an individual seeking services. When we look at what activities are being provided, we have to capture that in the context of how does that activity supporting this defined population impact the mission, vision, and values of our institutional funder through the lens of benefits and outcomes on the program as a whole. Oftentimes, where we as community-based organizations fail to really articulate the activities that we are providing is we simply list an inventory of the things we are doing rather than the impact of the activity from the lens of the funder, the lens of the population being served, and the lens of our staff in conducting the actions in serving individuals seeking services. Where the services are being conducted is vitally important in defining down to the census tract and also the zip code level. For more information of how to determine what census tract your community-based service organization is serving, please refer to the resources section of this webinar, where a link taking you to census tracts will show you exactly how to plug in addresses to convert to the census tract numeric codes supporting your catchment area. Where are these services being conducted is important to showcase by census tract and zip code, because for most of our institutional funders, they are today supporting a geographic area that is aligned to census tracts and zip codes. Specifically, when we speak to banks, hospitals, and also local health department funders. Yes, a county level is also needed, but that is almost, in today's context of the scope of work, a routine data point rather than a preferred data point of census tracts and zip codes. Where the services are being conducted when aligned with census tracts and zip codes gives your funder the opportunity to include your program in their submissions to their funders to support additional areas of community and economic development. So please do take a look at the census tract area in support of how to determine your census tract. In services, you also want to account for the description of when are the services being conducted: daily, weekly, monthly, what days of week, what times of day, and really from the experience of an individual seeking services, how often does the individual expect to receive services versus how often are services actually being provided? And are there any specific barriers that you are resolving or reducing by conducting these services during these frequencies, these days and hours of operation? Oftentimes, as community-based organizations, we believe or think or assume that our funders understand the pain points and the barriers that our populations have to deal with. But if we do not present it in the services, written out as to why these particular services are provided during this frequency, these days and hours of time, etc., for supportive benefit of our population being served, our institutional funder may not understand why these services are being conducted at the times and days of week that they are. For example, most of our institutional funders are Monday through Friday, typically 8 a.m. to 5 a.m. working hours. Most of our community-based service organizations do not work within those timeframes. So define the times of day, frequency, and days of week for services being conducted because of results of your organization surveying community and residents on the best times of access, on the best locations of access, and ultimately on the best attendance and overall supportive timeframes for our communities and families should be noted within the services simply as one key differentiator that your community-based organization operates at times that your institutional funder does not, and provides direct service activities that your institutional funder does not. As we look at all of these components, we then showcase under services that as a community-based organization, we serve populations in differentiated direct service activities in locations at times that our institutional funders otherwise could not access or gain appropriate outreach service support to. With these four areas combined, then we discuss how do we report on impact of activities. Oftentimes, community-based organizations have the most concern regarding reporting to funders. The recommendation then is start with a plan and a position on how you will report. Take a look back at who you are serving. Have an opportunity to list out the demographics, socioeconomic levels, geographies, and the cultural competencies and how you are serving who you are serving. Those are four key areas. Then as you look at activities, how do you quantitatively and qualitatively showcase that those activities are being provided? Where are services being and conducted really showcases the number of encounters and where those encounters are being tracked. So if we have personnel that are specifically in different locations serving different services, then our report on the impact of those activities should detail who, what, where, when, and how those services are being performed. There are very simple templates that can be created to identify tracking of those services to start and training to support individual personnel on what is important to capture. So for example, as a community-based organization, if you're conducting training, who you are serving can be supported in a report by creating a sign-in sheet that allows those four categories to be collected directly in fields on the sign-in sheet and delivered via the information provided on the sign-in sheet: name, phone number, email address, and physical address. The activities that are being provided can be supported through a multitude of information pertaining to, in this training, here is the schedule and overall content that is provided in the training. So that would be the training agenda along with the materials provided. Where the services conducted could be here are the facilities, and then as part of the survey or even in an exercise conducted in the training, those that are being trained can showcase where their locations are, where they're going to be applying that training, and who they are and how they're going to be able to provide additional support and or informational access to others in the community and other residents that may be benefited by such training. When are the trainings conducted? How frequently? And also, what is the time between each training and when are they spaced out? How do we report on impact of activities from a training perspective has just been outlined. There are many other ways to create simplified reporting on a multitude of additional activities, from individual one-on-one encounters, group encounters, transportation support, all the way through to additional direct services from a clinical standpoint of volunteer-based behavioral health and physical health services through to education, tutoring, childcare, and so forth. For more examples, for one-on-one consult, please look to our technical assistance section where you can meet with our technical assistance providers and work with them to help you create a report template that is specific and customized to the services that you are offering today. It is always best to showcase to an institutional funder, here is what we do and how we report on the work that we do, versus waiting for the institutional funder to give you reporting requirements. Moving on to the timeline, we're going to identify the scope of work over the duration of time that is being recommended. Again, remember that you are recommending the length of time that you want to be contracted and bound to this particular institutional funder. So you identify, is this a 1 year, 2 year, 3 year relationship? Is this a new funder that you want to try and see if this partnership works out? Or is this a long-term extended funder that you really want to provide some strategic service scoping for a number of years, 3 years, 5 years, etc. So you determine what is the length of time for the scope of work. And make sure that as we look at whether it's 1 year, 2 years, or multiple years, that you really have a breakdown of major milestones per month of each year of scope. The reason this is recommended is often with multi-year contracts, we get embedded in the routine of doing the work and we don't identify necessarily major milestones or new innovations. In addition, we must always seek continuous improvement and look at the opportunities for innovation. Improvements and innovation equal opportunities for seeking further funding. Our funders want to see and understand what we do today in order for them to support us with funding to extend what we are doing by improving services and also adding innovation in service to our community. As a smaller community-based organization, there might be many other competitors within our market space that are doing the same type of service work that we are. So identifying major milestones per month of each year scope and really defining what those milestones are helps to differentiate not only our service capacity, but our continuous improvement focus as well. Now that we've identified the major milestones, we want to tie those services pertaining to milestones to the fee schedule. And the reason we do this is we've already identified, here's the listing of services that we do today. With any additional major milestones, that's increased benefit, enhanced scope of work, and ultimately more benefit to the community. So a key question of tying services to the fee schedule is, as you grow your organization, what does your organization need in advance to support personnel? What advanced funding, how much money is needed as you continue to grow the capacity of your services, the capabilities of your team, and the overall competencies of the personnel that is delivering the work? And last but not least, we tie the milestones to the fee schedule in support of understanding what impact is expected. How does the impact benefit the funder? And how does the expansion of the activities towards milestones support a greater benefit where the funder can share in the promotional and outcomes of the provided activities and milestones in publication, in press release, and in overall promotional marketing activities that benefit continuous sustaining funding partnerships between you and your institutional funder. When we look at timeline, starting off with what is the total time frame of scope of work, identifying major milestones per month of each year of scope, and then tying both the services and the milestones to fee schedule to ensure that additional personnel as you expand and increase your capacity and additional capabilities and competencies achieved are being funded by your long-term institutional funder partner. In our scope of work, we have a budget and fee schedule. The budget is specifically the quantitative cost and numbers of the work that we're doing in this project. The fee schedule is how we intend to complete and then bill for our services. Please also include what is your rate, what is your overall payment in support of the work that you're doing. Oftentimes, community-based organizations do not adequately count the overhead of leadership and administration into budget. It's vitally important to include those numbers to ensure that as you grow in capacity of personnel providing direct services, that you also have good infrastructure to continue to support the organization. What is your internal cost to provide services should be the first foremost number that you're looking at. And then consideration of what would you charge to provide these services. Most organizations on a community-based organization level will do what is known in accounting as a cost plus model, meaning that whatever it is your cost to provide the services, a additional percentage, the plus, will be added to the cost in order to identify the charge to provide these services. Oftentimes, our community-based organizations are asked to provide what are the salaries of your personnel and what is the allocated percentage of those personnel to the scope of work. That is typically in a grant-based narrative. In a institutional funded scope of work, this is not the case. You want to ensure that you are providing what you are charging, which is cost plus, to the institutional funder to ensure that you have not only the overhead, the direct service personnel, and all ancillary equipment, supplies, training costs, et cetera, accounted for, but that you have a plus left over to account for the services being provided, the strategy and the innovation being conducted long term. Most organizations will cost plus anywhere between 15 to 40% of their cost in these related community-based services. The difference between the 15 to 40% is dependent upon really the overall pace of services being provided and the speed of service to timeline. There is, of course, a value assigned to efficiency and a value assigned to collaborative and a value assigned to collective impact. So as you look at the charge to provide these services, consider the category that your institutional funder is in and do a little market research on the total awarded dollar amounts that are provided by each institutional funder and approximately the amounts provided to each organization and the type of services provided. Take a look at that from a competitive effort and then determine what your overall cost plus should be for this institutional funder. When we look at budget and fee schedule, we also want to consider what activities will require advance payment via retainer model and what activities will be completed on a monthly basis that is billable.
One is an advance payment request. The other is payment post-delivery.
What activities will be completed on a one-time basis that is billable is also of consideration. Typically, one-time billable activities are event-based, and event-based may have some cash upfront and then other payments based upon milestone. For additional support on budget and fee schedule, please refer to the technical assistance component of the DMHA Cultural Linguistic Competency 3.0 Organizational Excellence Toolkit to select a time to meet with a technical assistance provider to help customize your budget and fee schedule specific to your community-based organization. That wraps up the components of what is a scope of work and how to create an overall scope of work within this webinar. The last component of today is to take a look at understanding how your institutional funders are funded and tracking the benefit to funders when they are contracting with you to support direct service work to the community. As we've discussed, your ask is aligned with institutional funding goals. Of the 7 categories that we've identified, here are the funded initiatives for each major category that you should be aware of as you design and create your overall proposal which includes a cover letter and your scope of work. Your scope of work, which includes your services, your timeline, your budget, and your fee schedule. In these 7 categories, from banks to large nonprofits, we've identified some major alignments of US federal acts, initiatives, and standard business protocols that impact the alignment of an institutional funder to want to be a funding partner to you in support of your direct services to the community. For banks, the Federal Community Reinvestment Act requires banks to provide a percentage of their net profits reinvested into their local community. We have aligned these categories in a ranking of perceived and preferred relationships based upon current existing federal acts, initiatives, and also standard business protocol. So we are recommending to every community-based organization going through Organizational Excellence Toolkit to create relationships with their local banks due to the Federal Community Reinvestment Act that supports overall net profit-based reinvestment by banks into their local community. That creates a tremendous opportunity for funding support from a non-grant, direct proposal, detailed scope of work basis from you as a community-based organization to your local banks.
Every bank has
a requirement to publish the amount of money that is supported to local communities on an annual basis. That information can be determined through publicly available websites and public available filings provided by each bank on an ongoing basis. For more direct technical assistance support, please connect under the technical assistance webinar, where you can schedule directly with a technical assistance provider to undertake information and customized navigation for your community organization. Hospitals are required by law through multiple health and human services agencies to provide community needs assessments and outreach towards resolving key issues identified in those community needs assessments. Hospitals are a wonderful partner, and most hospitals also have direct foundations where net profit is allocated to foundations to support community initiatives and community funding to partner with local organizations to resolve community needs through direct service. Hospitals directly, as nonprofit organizations, also have marketing sponsorship dollars and community outreach budget to support, again, direct community connection, outreach, and engagement initiatives. Local health departments generally are not ranked as high in our institutional funding rankings, except for a recent state of Indiana initiative called Health First Indiana, which was an opportunity that is now funded to and accepted by 91 of 92 counties as of May 2024, where dollars allocated to local health departments are being supported through local health department procurement decisions to local funded agencies and community-based organizations to resolve social determinants of health concerns. Under the resource section, there is a link regarding Health First Indiana and the key performance indicators that have been assigned by state legislature to the state Department of Health and funded down through to local health departments to, again, provide funding to local-based community organizations to support these initiatives. Each and every local health department will make their own procurement decision on how they intend to fund out these dollars. And they will also determine whether or not these are grant-based, institutional funder-based, and or directly supported to existing partners. So please connect with your local health departments after reading through Health First Indiana to determine what their procurement process will be for those dollars awarded. Higher education, as the fourth category, is a significant focus on recruitment and enrollment. Across the country, we are expecting a significant increase in supply of jobs with not enough skilled workers to support that demand. When we look at the higher education portfolio, almost all public institutions in the state of Indiana have a recruitment enrollment plan that is specific to non-traditional alternative adult education
Focused on first-time collegiates and also certification-based training and education.
If your organization works on workforce, higher education has significant recruitment and enrollment dollars to account for the positioning of their majors, certifications, and ultimately graduation placement in support of collaborative partnerships with community-based organizations to determine individuals that would be benefited by the current curriculum offerings of these higher education partners. Employers, small businesses, and large nonprofits are currently at our bottom rankings for institutional funders, as employers, small businesses, and large nonprofits are hyper local in their effectiveness and their availability of dollars. Key employers that have set up foundations to fund community programs are very specific to aligned mission, vision, and values. Employers such as Eli Lilly, who have created Lilly Endowment, and multiple pharma diagnostic companies that have foundation-based outreach and charitable funding opportunities, are specific in providing a detailed annual funding plan. Please look to those employers, large employers within your local and regional geographies to determine whether their foundations have released such plans and what the opportunities are in seeking direct institutional funding through a scope of work based proposal rather than a more traditional grant based approach. Most employers that are large regionally but may not be statewide or national may or may not have a precise process in place to support funding and outreach. So always take the leading initiative to submit a scope of work proposal on the work you're already doing and the impact that you're already having in your shared community. Small businesses are typically looking at a development of supply chain and ecosystem, not only from a recruitment of individuals to staff their growing organization, but also partnerships and better understanding the economic impact of the local geography and having you as a community-based service organization providing data and also understanding of how the ecosystems, what the ecosystems needs are today is vitally important in supporting small business growth and small business development within the regions. Large nonprofits, especially when looking at large nonprofits that are taking on a traditional grant maker role rather than a direct service role, often leave a component of direct proposal review for innovation and also on challenges and barrier areas that they may not have exemplified in their annual reports. So a better way to state that is large nonprofits
Themselves have key performance indicators and metrics to abide by. Your scope of work may be the answer
to a specific large nonprofit's area of innovation interest or in a large nonprofit's specific challenge or barrier area that they have not yet been able to resolve. So ensure that as you are sharing your proposals and scopes of work, take a look at the speed of response from each of the categories of institutional funders and look at, again, annual initiatives and alignments towards your mission, vision, and values. You do not want to change the level of service nor the standard of service that you're providing to the community today. You want to lead the initiative and direct from a position of expertise of what the community needs. And by utilizing your scope of work as the document provided to these organizations, truly a plan seeking their role as an institutional funder while maintaining your role as the service provider, the direct access to the community, the data collector, and the outreach and engagement evaluation coordinator. This has been a tremendous amount of information shared regarding non-grant making fundraising strategies for specific and customized approaches on any of the areas identified today. Please gravitate towards the webinar on technical assistance and coaching. Under the resources section, there is a scheduling availability to connect with our technical assistance providers to provide specific and customized templates, reports, and approaches to
Your scope of work submission to your institutional funders.
appreciate your efforts and time and your service to the community. For any additional questions, please reach out to the technical assistance providers. And for additional feedback and support, please connect with
The Division of Mental Health and Addiction.
with Carrie Jones, Health Equity Director. Thanks for attending. Have a wonderful day.